Welcome to my video. In this video, we will tell what is a blood clot in the legs. The blood clotting in the leg is a serious medical condition that requires immediate attention and treatment. Understanding the causes, symptoms, treatment options, and precautions, you can reduce the risk of becoming blood clots and their complications. Its symptoms, most importantly, its treatment options. First of all, you know what the blood clot is. The bloodstream is a flag of blood that is made in the vein or the artery. When in a deep vein, usually in the legs, it is also called deep vein thrombosis or DVT. Symptoms of blood clots in the legs: swelling and pain in the affected leg, heat and redness in the affected leg, weakness or pain in the affected leg, skin color or ulcers. Treatment options. The treatment of blood clots in the leg usually involves a combination of medication and lifestyle changes. 1. Anticoagulation therapy, blood thinner, such as heparin or warfarin, are used to prevent the growing body from growing and prevent a new gym from becoming. 2. Thrombolytic therapy. The freezing medicines, such as TPA, are used to dissolve the gym. 3. Filter space. A filter is kept in the vena cava to prevent the free maid from becoming loose and moving to the lungs. 4. Command socks. Wearing compression stockings can help reduce swelling and prevent blood accumulation in the legs. 5. Surgery. In some cases, surgery may be necessary to remove or repair the frozen veins. Changes in lifestyle. In addition to medical treatment, lifestyle changes can help reduce the risk of blood clots and their complications. 1. Be dynamic. Regular exercise can help improve blood flow and reduce the risk of freezing. 2. Maintain a healthy weight. High weight can increase pressure on the veins, which increases the risk of blood clots. 3. Avoid sitting or standing. Take regular breaks to rotate and pull. 4. Hold. Drinking large quantities of water can help prevent blood from being thickened and sticky. The recurrence. To reduce the risk of frequent blood clots, continue anticoagulation therapy as directed. Monitor the symptoms of blood clots. Maintain a healthy lifestyle. Thank you for watching the video. Don't forget to like and subscribe for more health videos.